So what are some things people can watch out for?
Typical type things, so back pain that kind of doesn't go away on its own. Certainly if you start to develop any type of symptoms where what we call radicular symptoms or nerve type symptoms.
What's your favorite part about getting to interact with patients?
They come back usually 3-4 weeks after the surgery and they give you a big hug. That to me is what makes it all worthwhile.
Is it true you play guitar as well?
Yeah, well, actually, when I was over in Switzerland, I read every book I wanted to read, so I said, well, I'm going to teach myself an instrument.
So here with Dr. Jay Antinnes, how are you today, Steve?
I'm great. How are you doing?
I'm excited to be here. I'm
Great.
good. So you're an orthopedic spinal surgeon.
Correct.
And you treat mostly scoliosis, right?
Well, yeah, it's a part of what we treat. Scoliosis is a kind of a little bit out there throughout the community, and so that's part of kind of the whole spinal complex of things that we treat here.
What is the most common issue you see with patients here at Southern Bone and Joint?
Probably the most common thing by far is just your typical back pain. You know, somebody was out cleaning the garage over the weekend, maybe overdid it a little bit, come in on Monday morning, oh my gosh, my back is hurting. So that's a pretty common thing, and it happens probably just about to everybody at some point. And so we see a heck of a lot of that. As far as the more kind of involved pathology, we see a lot of disc herniations and spinal stenosis, which is a narrowing of the spinal canal, neck problems or disc herniations and arthritis there as well. So yeah, scoliosis is part of what we treat here, but basically we treat just about everything from the base of the skull all the way down to the tailbone.
So you're treating the entire spine. You had to do a lot of studying and training to get to this point, and you've studied and trained and worked all over, including in Switzerland.
Correct.
What was that like, that process getting to this point now?
Oh wow, it was kind of a roundabout journey for me. I actually originally wasn't going to go into medicine. My initial plan was I actually majored in college in mechanical engineering. And kind of at the end of my mechanical engineering got into bioengineering and biomechanical engineering. And so that was what my plan was going to be. And in my last year of college, one of my professors kind of asked me to do some research with him over in Switzerland. And I said, sure, I'll sign me up, I'll go. So I ended up going over there for what was going to be just 1 year, but it ended up turning into 3 years. And we did a lot of research on the spine and biomechanics of the spine. So long story short, as I got involved with one of the guys that I worked with over there was a really well-known spinal surgeon, and he kept bringing me into the operating room. Well, I started to fall in love with the surgical side of things as opposed to the mechanical side of things, and that kind of turned my life around, and I ended up coming back and going to med school after that, and that's what got me into this area of spine.
What are some of the similarities between engineering and surgery?
Oh, there's a lot of similarities as far as, especially in orthopedics. I mean, basically we are mechanics of the body for the most part. I mean, whether it's a knee joint, a hip joint, certainly in the spine, there's a lot of forces and, just the way that the body works kind of as a machine. It's nice to be able to understand both the mechanical side of it all and then the medical side of things. And when you can kind of marry the two, it works out really well.
So what's the biggest difference, being in Switzerland, working in Europe, and then working in medicine here? What did you take away from that experience?
That's a good question. Well, in Switzerland in particular, obviously it's kind of a melting pot of different nationalities. There's always somebody walking in that is coming from somewhere else, and the different languages that were spoken. They would be speaking to me in English, and then turn and speak in German, and then talk to somebody in French, and yell to the nurse in Italian. So it was a great experience from seeing all sorts of different cultures and people. But at the heart of it all, the medicine's the same. The people may be a little bit different, but they might have been a little bit more progressive in terms of they had a little bit more freedom at that time. That was 20-something years ago. They had a little bit more freedom to experiment with different techniques and instrumentations and things like that. But at the heart of it all, it's pretty much the same.
So taking that experience, you're now treating the spine here in the States, in the South, right? Are you originally from the South?
Nope. I grew up in the Northeast in Pennsylvania.
Oh, man. So this is kind of
It's a lot cooler up there, by the way.
So when you look at the spine as a patient, right, what are some ways I can take care of my spine so that I don't necessarily get into trouble? Or I know overusage can be an issue, but what are some tips you would give patients?
Well, I mean, we talk about this all the time with folks, is that the spine is a series of joints and linkages, just like any other joint in your body. And so, yeah, it is important to try to take care of it. At the end of the day, staying fit, trying to get a little bit of exercise in, maybe not too much exercise in. Some of the folks we see on Monday mornings after doing a little bit too much in the weekend maybe did a little bit too much. But nonetheless, the spine somehow seems to be a mysterious structure. But in reality, in its simplest form, it is just a part of the body, just like a knee or a hip joint. And it is something that if you treat it right with, having a good diet, regular exercise, trying to keep your core strength up, all of those things, stretching, all of those things go towards having some good back and spine health.
With everyone on their phones now, I know when I look at my phone, I tend to hunch over. Is that a thing that you see more often?
Oh, that's a good question. I don't know of any studies that would prove that at this point. I'm sure they're probably working on them. But we do see other fields in which people have their neck in one position for a long period of time, like surgeons, where we're down like that at a long period of time. But we see a lot of welders, dentists, dental hygienists who are kind of constantly in an awkward position. It does put some loads on the spine, especially in the neck, where you can see them actually see those types of people a lot more frequently. So I would venture that probably being on the phone for long periods of time, and I see kids walking around nowadays where that's all they're doing, may come back in 20 years to find out that, that plays a role in it.
Makes me want to sit up a little bit straighter.
Right,
Being a surgeon seems like a very high-pressure job. What do you love most about it when you actually go in and operate?
Well, I like boring surgeries, to be honest with you. I like when things just go smoothly and just as planned, but that's not always the case. And so, when things do get a little bit dicey, you just have to rely back on your training and try to keep a cool head, because getting excited about it at that moment really doesn't do anybody any good. So you just have to kind of check yourself. And when you get done with whatever that particular surgery was that was maybe a little bit exciting, you can relax then and maybe let some of the emotions out. But you have to really stay in the moment, just like probably any other business or sports industry. They always say stay in the moment. Well, you really need to, especially when things start getting a little bit dicier, you're working around the spinal cord or nerves. You just have to rely on your training and just focusing on that.
We speak about being like a quote-unquote organic mechanic, right?
Right.
There's a person side to this. There's a people aspect to that. What's your favorite part about getting to interact with patients and help people out?
Well, it's just that. I mean, when you see somebody walk into your office where they've been hurting for weeks or months or sometimes years, and they come in with a problem that you were actually able to help them with, and they come back usually 3-4 weeks after the surgery and they give you a big hug, that to me is what makes it all worthwhile. When you've taken somebody who's just had a part of their life kind of taken away from them, and you can give that back, or at least a good part of it back, it's super rewarding. So to me, that's the most moving and engaging part of dealing with folks. I mean, I like dealing with people just in general. I like sitting down and talking with them about their families and all of that, but I think that's a part of it.
So what are some things people can watch out for, like warning signs, not just necessarily with scoliosis, but that something might actually be up with the spine so that they can get checked out?
Well, I mean, kind of typical type things. So back pain that kind of doesn't go away on its own. Certainly if you start to develop any type of symptoms where what we call radicular symptoms or nerve type symptoms, where I've got a burning down my leg or a numbness in my foot or my hand can't feel things, those would be things that you probably ought to consider getting checked out. I mean, it's not that it's normal, but people do experience temporary numbness if you slept funny on your arm or something like that. But if it's something that's just lingering around a little bit longer than what would be considered normal, then yeah, by all means, come on and have it checked out.
So scoliosis sounds serious, right? Is that something that if I have it or if I see you about it, I have to have surgery?
No, is the short answer. I mean, when you look at scoliosis, we don't really even know the true number of the population that has it, but there's an enormous amount of people. It's estimated about 7-8% of the population has some degree of scoliosis. So there's millions and millions of people walking around with little curves in their back, and they can function fine and don't really have any problems with it. So the vast majority of people we see with scoliosis don't need anything other than just a little bit of a follow-up. The ones that we get concerned about are usually the children who have a higher chance of progressing with their curve as they continue to grow. And so those are the kids that we want to just follow. And even the kids that we follow, the vast majority of them don't need anything other than an x-ray every 6 months or so as they grow. A very small percentage of those kids might need some bracing. And then of those, an even smaller percent ever need anything done surgically. So the vast majority of people who have scoliosis really don't need any specific treatment other than just keeping an eye on it and making sure it isn't one of those that has a chance to get worse later on in life.
Is early intervention important, though?
Yeah, I think it's that's one of the most important things. If you can detect scoliosis at a younger age, and the folks in our community here do a great job with screening at schools and on well child checks and even sports physicals. I see a lot of folks come into me after having a sports physical and say, hey, we think we see something here. Yeah, because if you can catch somebody early, maybe get them into a brace where you can prevent it from getting to the surgical stage, you can really dramatically affect their life in a positive way. So yeah, the sooner we get to it, the better.
Now, you mentioned sports. I hear you're an athlete.
Well, pseudo-athlete.
Did you play some basketball? Is that true?
I did. I played basketball. I sat the bench for a long time in basketball, but I did play in college, and then I'll obviously played through high school, and I played a little soccer and a little baseball, but basketball was probably you wouldn't know it my size-wise. I was kind of gritty, I guess, but bottom line was I enjoyed it, yeah.
You had a jumper, though, like John Stockton, right?
I was streaky. If I was hot in warm-ups, it meant I was going to have a horrible game. I would rather miss everything on warm-ups. I knew then, hey, I got a chance of getting streaky during the game.
You got to save all those good shots.
Exactly. You don't want to waste them in warm-ups, right?
Is it true you play guitar as well?
Yeah. Well, actually, when I was over in Switzerland, when I first got over to Switzerland, didn't know anybody, didn't know the language, just was plopped down in the middle of Zurich. I read every book I wanted to read, so I said, well, I'm going to teach myself an instrument. So I went out to a used guitar shop and bought a guitar. And so I've been playing now probably 20 or 30 years, and I love it. It's something that relaxes me at night, and plays in some fundraising things every once in a while around town here. But yeah, it's something that gets my mind off of medicine and all the stresses around, so it kind of helps you focus.
So basketball player, guitar player, spinal surgeon.
Yep. I don't know if it's that order, actually.
Thanks so much for sitting down with me. This was great.
Yeah, I enjoyed it. Thank you very much.